Hi, I'm Kiersten Wise. I'm an extension plant pathologist with the University of Kentucky, and we're in a Kentucky cornfield today to talk about some of the foliar diseases that we're seeing in corn. Now this is going to be a good time to go out and scout fields. What we want to do is look at our fields just prior to tasseling to see what foliar diseases are out there and how severe they are, so we can make decisions about whether or not to use in-season foliar fungicide applications. Now when we're looking for some of our foliar diseases, what we want to be focusing on are going to be some of the mid to lower leaves in the canopy. So really our corn here is a little too early, but what we want to find is the ear leaf, and then look at the ear leaf and the leaves right below the ear leaf. All right, we're going to start in the lower canopy and look at some of the diseases that we're seeing. Now I want you to note that this is corn following corn. You can see all of the corn residue down here. So this is going to be a crop of corn that's going to be at higher risk for foliar disease development because many of our common corn disease pathogens are going to survive in corn residue. So here's a leaf from the lower canopy that has some symptoms of anthracnose leaf blight. And you can see some of those rounder lesions that expand across the leaf veins. And if we were to put these, if you were to use your hand lens to look at them, lots of times you'd be able to see the structures of the fungus that causes this disease. And those structures will have sort of these black hair-like projections coming from them, and that can help diagnose or tell anthracnose leaf blight from another disease like gray leaf spot. And these are going to be some young lesions of gray leaf spot. And you can see they're very small. They're sort of a tan to gray appearance. And these are actually just going to expand parallel to those leaf veins and get larger as the season progresses. And this is one of those diseases that we want to be scouting for. It's an annually important disease in Kentucky and one that we often need to use foliar fungicides to manage. And so this is a good one to be able to identify. Now, it is also important to note the hybrid susceptibility to gray leaf spot, because in more susceptible hybrids, these lesions will continue to expand. But in hybrids that have resistance to gray leaf spot, many times those lesions won't expand as much and they may be restricted and small. So you might see some out there, but you'll want to check your hybrid resistance rating before you spray, because sometimes we don't often see good response from foliar fungicide applications in hybrids that have good resistance to gray leaf spot, even if you're seeing a little bit of disease out there. Here we have some lesions of northern corn leaf blight. This is one that we see when we have a little bit cooler temperatures, although we can see it pretty commonly in Kentucky. These are going to be younger lesions. You can see here this is a lesion that's just starting of northern, and this is going to be a lesion that's progressed a little bit more. But these can, in a susceptible hybrid, these can expand up to several inches. Now, one way that we're going to be able to tell northern from some of the other diseases is that, again, if you have your hand lens out in the field, particularly on a wet morning, you're going to be able to see a lot of the spores of the fungus that causes northern corn leaf blight right in the center of that lesion. So that's going to be one way that you can identify it or tell it from some of our other foliar diseases. Okay, and here we have the disease Diplodia leaf streak. And these are some young lesions or early lesions of this particular disease. And again, just like northern and gray leaf spot, over time these lesions will expand up to several inches. But it's really important to know the symptoms of this disease in this early stage, because they're very easy to confuse with anthracnose, gray leaf spot, and some of our other foliar diseases. And lots of times with this, you'll have these very round lesions, sometimes with that halo, a yellow halo that you see there. But as these progress, you'll see sort of a bullseye pattern in the center of the lesion, and you'll see little black structures in the center of these lesions, and those are going to be the fungal reproductive structures. And once you see those, that's a good way to diagnose the disease, but you can also take them into the lab and look at those fungal structures and to identify it as the fungus that causes Diplodia leaf streak. Here we're scouting a field that's a little bit closer. You can see it's tasseling and already has some silks out, but we're here in this field to look at a couple of diseases that are very easy to confuse with each other and maybe a little bit misunderstood in Kentucky. Those diseases are going to be Holcus leaf spot and curvularia leaf spot. Holcus leaf spot is a very common disease in Kentucky. We have seen more of it over the last few years, and so I think farmers and crop consultants are now more aware of it than they have been in the past and are able to see more of it. Holcus is caused by a bacterium, so it's a little different than some of our fungal diseases, and you can see it's going to have sort of these cream or tan colored lesions. They're going to be very round, sometimes surrounded by a halo. And if you read much about Holcus, it's going to tell you that it's usually confined to the lower canopy, and you don't really see it in the upper canopy past tasseling. We also have a disease that's a little bit newer in Kentucky, and that's called curvularia leaf spot. Now, this was first officially reported in 2018, but it had been observed in Kentucky fields a few years previously. And this one is going to have a little bit smaller lesions, usually cream to tan colored, also surrounded by sort of a yellow halo. And typically we see this appear first in the upper canopy and can kind of be up in those upper leaves. Now, curvularia at this point in time, we find it across the southeast. We don't think of it as a yield limiting disease at this point, but it's something that we definitely need to keep an eye on and make sure we're identifying correctly. Now, the real problem is going to be when we're finding Holcus and curvularia leaf spot in the same field or even on the same leaves. And so you can see here's a good lesion of Holcus leaf spot, and then further on down the leaf you can actually see there's some curvularia leaf spot as well. And so they can be confused when we're looking at them together. One of the things we're seeing in Kentucky this year is that we're seeing Holcus leaf spot in some of the upper canopy in some areas, and curvularia leaf spot, although typically confined to the upper canopy, can also be found in the mid to lower canopy. And so this is important to remember if you're reading the literature about where to scout for these diseases or where you most commonly might find them. You know, sometimes we can find them with the right environmental conditions in some areas on the plant that we wouldn't normally expect. And so that can help with that can actually confuse diagnosis, but what we can do is always send the samples off to a diagnostic lab if you're not sure what you have, or you can take them into the lab yourself and incubate the leaves to look for the fungal structures that cause curvularia leaf spot. That's going to be a good way to know whether it's the fungal disease curvularia or the bacterial disease Holcus leaf spot. Now, both of these diseases, while they are striking and you can see them in your fields, they're pretty minor diseases at this point in time, so they don't require management.